Hi, my name is Tara Talbot, and this is my dog Evie and my clinic mentor, Dr. Trish Briggs. We'll be starting with our eye exam. She doesn't have a true history of her eyes other than getting some sleep in her eyes in the morning, but we want to make sure that her eyes are okay. So we'll start by checking for her menace response. Okay. So we'll moving the finger towards the eye but not creating a breeze. See if we blink. We blink. She's holding her eye open. She does close it a little bit. The palpebral response. So normally you would do this to see if anesthetized patients have a blank response, for example. We are blinking in both eyes. Good girl. She appears to have normal eye conformation, just with plain eye view. Evie, no blinking. Pupillary light response. So we'll be doing direct and indirect. Oops, no, I'm doing that. So direct is going directly into the eye to see if her pupil constricts, which it does, and the other one also constricting at the same time is consensual. So she has normal pupillary light response. And then I look at the retina. See if it looks bright and shiny. No abnormalities that I can see or am aware of. Next we do the Schirmer tear test. So that's to see if they have enough tear production in their eyes. So each strip goes into the eye for 1 minute. They need to produce up to at least the 10 mark on here. That's the bare minimum though. So place it into the bottom of her eye. There you go. I know we're blinking a lot. I wouldn't like that either. And then count for a minute. It can be a long time. Don't know if it's in there properly. Hey, you got no tears. No. Believe that's in there properly. There you go. So you can see the tears moving down the strip. Good girl. So got our 24 to 25 millimeters. She's like, take that out. There we go. Proper amount of tear production. So she doesn't need a swab. I'll clean out some of her eye discharge since we do have little boogies. Okay. So using a nice clean gauze and some eye wash. She doesn't have an eye infection, so we can just use this for both eyes, but if we were concerned about an infection like yellow or green discharge or an ulcer, we would use separate gauzes. The fluorescein stain test. So I pre-made this with the fluorescein strip into a syringe because we don't want to touch it directly to the eye. You can damage it. And then added the eye wash into the syringe. So place that into the eye. If she's willing. She's a good girl. Ooh. Well, we're gonna have lots of yellow boogers. It does come out into their nose. Hey, you good girl. Wipe away, flush away the excess. Hey. Oh, good girl. You getting it everywhere? Sorry, guys. Hey, good girl. I'm a mess. Those vets make it look easy, don't they? They make it look so easy. So this will help show us if there's any damage to the cornea. Check for any ulcers.
Turn the light off.
Thanks, Alicia. Which is our VTEC. She's holding the camera. So check for any defects on the eye. So the pooling at the bottom there is normal, just collecting around the eyelid, but we don't see any defects on that eye, the left eye, and then the right eye also looks normal. Perfect. So you got good eyeballs. So we can see if there's any coming out of her nose. I don't see any. So, okay. Now we'll do the tonometry test. The tonometry test, it checks the eye pressures, commonly for uveitis and glaucoma. So this is our tonometer. We want to keep the end of it sterile. So place the end there. So I need to hit this in rapid succession, about 4 to 8 millimeters away from the eye, about 1 centimeter, and keep it perpendicular. So don't know if I'm doing that properly.
It's good.
10, 12. Good girl. So that was our left eye. And now our right eye. Just wait. Evie, it's okay. Just wait. Good girl. I know. Pun intended. 11, 15, and 11. Good girl. Good job. And our last thing to do, instill drops or ointment. So we have some plain eye lube. She doesn't need any medication today, but let's say she was anesthetized. We want to keep the eyes lubricated. Okay, now you're gonna have some eye goobies. Okay, here we go. Good girl. Good job. Oh, come here. Good girl. And we're all done. Thank you, Evie and Dr. Trish and Alicia, our tech. Hi, my name is Tara Talbot. This is my patient Jaeger and my clinic mentor, Dr. Trish Briggs. And we're gonna do an ear exam. So I've got our checklist here. He was born deaf, so he doesn't hear as far as I know. So do an external ear exam. There's no erythema, which is redness. There is a tiny bit of wax. He's lazy. He's not good at cleaning himself, so my other cats groom him. So now we'll look down into his ear. So pinnas look normal. We look down into the auditory canal. I wasn't sure how you would be for this, but you got volunteered. So it looks waxy because he's disgusting, but there's no purulent discharge or any dark brown debris. There's not excess hair. Hey bud, I know, you're a turd. I know. He sounds like he's tortured, but he's just deaf. So his ears look good. The tympanic membrane or the eardrum, it should look like a clear, thin membrane. I couldn't quite see it. But the rest of his canal looked healthy and normal. So the last thing that we're gonna do is an ear clean for him. He should love this. Okay. I know, I'm sorry, love. So you can gently hold the pinna and dump the cleaner into the canal. And then you gently massage the base of the ear. Very cooperative. I know. To massage the fluid down into the canal. You're the best patient. I don't know why I chose you. And you can use ear swabs, or in this case, we'll use gauze. Wipe the outside too, because that got everywhere with his head shaking. We got some mild waxy debris, but nothing serious. It's a normal amount for him. Sorry, buddy. That's one ear, the left ear. We'll do the other ear. Sorry, dude. I know, honey. So we did use Feel Away on the towel, and I sprayed it on myself as well. He was given gabapentin this morning, but it hasn't helped. If he was aggressive, we would use a muzzle. And I do have treats here to try to make him happier, but some patients just aren't. And that's the end of my video. Thank you.
Action.
Hi, my name is Tara, and this is Rigby. He's a good boy. And this is Dr. James Kirkham, and this is his dog. So it doesn't have any medical history for his ears, but we're gonna do a check on him anyway. And he has good hearing as far as we know. He responds. He's not deaf, unlike my cat. So outer ear exam, we look good. He's a little flush because he has very pink skin and he's excited, but it's a normal amount. It's not erythema. Now we'll look with the otoscope. So lift pinna, look in, and then we lower the pinna to get the views that we need. There's a little bit of waxy debris, but nothing concerning. So that was our left ear. And we'll look in our right ear. Rigby's such a good boy. Again, just the tiniest bit of wax, but that's normal. He's a good boy. So his tympanic membrane or the eardrum looked the same. It's a clear, thin membrane. So we don't need to do a swab or ear hair plucking. Doesn't have very hairy canals. So we're just gonna do a basic ear clean with the Otis scrub. So left ear and fill the canal. And then we massage the base of the ear. Not getting the squish noise. There. So we wait for the squish noise. That means the fluid has made it down into the canal. You can let them shake if it needs to. And then wipe out any debris with the gauze. Okay? Oh, such a good boy. Some patients do need to be muzzled and restrained in the neck, but Rigby's very good. Yeah, you'll get lots of treats after. Hey, it's a good boy. Some patients also need gabapentin and trazodone on board, but again, he's a good boy. Filling the canal in the right ear. Wait till we get that squish noise. You don't have squishy ears. Go. And then you could shake. Good demo dog. Yes. Gold star patient. You good boy, Rigby. Okay. Wiping the excess. Okay. And he only has a tiny bit of waxy debris. There's barely anything. He has nice clean ears. Mom and Dad take good care of you. And that's my ear cleaning demo on a dog. Thank you.